A modern hospital is equipped with all of the technology, equipment, and personnel to provide excellent patient care. Patients in need of surgery have fears and concerns about their care. Successful surgery depends upon the coordinated activity of a well-prepared surgical team. Team members must work together, and each must do their job well to meet the needs of the patient. The patient is the focus for all team activity. Nurses are the primary patient advocates during the perioperative experience. While perioperative nurses follow established roles and responsibilities in today's perioperative environment, the history of the profession is an integral part of our approach to patient care.
The year 1855. The place, the Crimean Peninsula of Russia, jutting out into the Black Sea. The event, the Crimean War. The innovation, a nurse whose name symbolizes all that is best in the nursing profession. Florence Nightingale, the lady with the lamp. Until she tended the wounded and dying at the field hospital in Scutari, there had been little or no formal nursing, and certainly not military nursing by women. But Florence Nightingale was made of stern stuff. She and a small group of like-minded women virtually forced their way into the war. They were to be the first perioperative nurses. Since there were no anesthetic agents available, one of the nurses' most valuable services would be to hold the hands of and give heart to the soldiers who were about to undergo surgical procedures. If the patient survived the surgery and did not hemorrhage, the next hurdle would be to overcome the usually acquired infections. In the Crimean War, more soldiers eventually died of their wounds than were killed in enemy action. On these battlefields, perioperative nursing began, with a rich heritage and many obstacles to overcome. Schools of nursing, based upon the Nightingale model, appeared in the United States by the year 1873. Each incorporated operating room nursing into the clinical instruction of its nursing students. Nurses became instrumental in implementing new standards of cleanliness, education, and organization in the hospital setting. By the turn of the century, experience in the operating room was required for nursing licensure in some states. Operating room nursing became one of nursing's first areas of specialization. From 1900 to 1920, significant changes occurred in the recognition and control of bacteria. The first temperature-controlled sterilizers were developed, and surgical gowns, gloves, caps, and masks were now visible in every operating room. By 1920, the National League for Nursing had developed a standard curriculum of operating room technique, which served as a model for preparing surgical nurses. Two distinct and separate roles had emerged. One was the sterile instrument nurse, and the other was the circulating nurse. By the early 1940s, two other major medical advances had transpired: the discovery of antibiotics and the ability to give blood transfusions. These innovations would help save many lives during World War II, as thousands of soldiers were rushed to the operating room. The mounting numbers of wounded required many individuals to provide care. Corpsmen were trained to take over activities previously done by the operating room nurse. The military nurse relinquished the role of scrub nurse and accepted new responsibilities for preparing the surgical patient, delivering anesthesia, assisting the surgeon, managing supplies, and teaching corpsmen. After the war in 1949, operating room nurses joined together to organize their unique specialty in the Association of Operating Room Nurses. The following years brought continued refinement of operating room nursing and development of standards of practice. The field of surgery entered an era of technological advances which created new surgical frontiers. These advances required nurses very different from their predecessors of 150 years ago.
The physician's name? Dr. Corpora, all right. And the type of procedure, please?
Long before the patient gets to the operating room, the surgical team is preparing for the procedure. When surgery is initially scheduled, it is noted what personnel and equipment will be required.
And the procedure? Lumbar laminectomy. All right. Any special needs for this patient? Okay. SSEPS, all right. And the OEC C-arm, all right.
Many hospitals have pre-admission nurses who contact the patient prior to surgery.
Hello?
Good morning. May I talk to Mr. Bob Smith, please?
Yeah, speaking.
Hi.
This nurse may be the patient's first contact with a hospital. It is important to make a good first
I'm going to
impression.
have a surgery on March 27/06 on Monday, 10 a.m. for ventral hernia repair.
10 a.m., correct.
The nurse explains the reason for the call and takes the patient's medical history, including information about allergies, previous
sir, your height
surgeries,
and weight,
medical
please?
problems,
I'm 6'8".
and medications.
175.
Okay. Do you have any medication?
Yes, I take a cholesterol medication.
Okay. Do you know the name of the medication?
Dosage is 10 milligrams and it's Crestor.
Do you have any previous surgery done, sir?
Yes, I have. I had a gallbladder taken out about a little over 6 months ago.
They discuss the patient's scheduled surgery and concerns. The nurse answers the patient's questions. The patient receives important information about preparing for the day of surgery. This includes the time to stop eating and drinking and when to arrive at the hospital. The nurse develops an individualized plan of care based on the patient's history. The nurse will communicate this information to the nurses in surgical admitting and the operating room. On the day of surgery, the friendly and efficient manner of the nurse who greets the patient helps to instill confidence and reduce anxiety.
Good morning.
Good morning. I'm Bob Smith. I'm scheduled for surgery today.
All right. Oh, yes, Mr. Smith, I see you right here. Would you sign in, please? Thank you so
Okay.
much. If you'll have a seat, one of the nurses
Right
will
there.
come and get you in just a moment. Okay? Great. Thank you.
Okay, thanks.
Too long?
Yeah, they said exact 10 o'clock. January 6th, 1954.
All right. Do you have any medication allergies?
I am taking a medication for cholesterol.
Do you have allergies to
I-
any medications?
Don't have any allergies, no.
Okay. And do you wear dentures?
No, I don't.
The admitting nurse verifies the information on the chart and begins implementing the plan of care.
Tell me, what are you here for?
Each team member who cares for the patient communicates information to other members of the team. Information like the patient's name, allergies, and surgical procedure may be verified several times.
Very good.
All information is kept confidential.
Anesthesia yet? Mr. Smith, we're going to start the IV for you.
Everyone is concerned for the patient's comfort and safety. The patient's privacy is respected. In the pre-op holding room, the nurse will begin to prepare the patient for surgery. An IV may be started, and excess hair from the incision site can be removed. The goal is to minimize the patient's exposure to infectious microorganisms during the surgical procedure. Traffic patterns divide the operating room suite into 3 specific areas, defined by the activity that takes place there. These areas are called unrestricted, semi-restricted, and restricted. Unrestricted areas include a control point where personnel monitor the entrance of patients, personnel, and materials. Here, information is communicated between the surgical suite and the rest of the healthcare facility. Street clothes are permitted in unrestricted areas. Beyond the unrestricted areas, surgical attire must be worn. Closed doors, signs, or barrier markers indicate the division between these areas. Semi-restricted areas include peripheral support areas, such as workrooms for processing and storage of instruments, corridors through the restricted areas, and storage for clean and sterile supplies. Surgical attire is required in semi-restricted areas, but a mask is not necessary. In restricted areas, surgical procedures are performed and unwrapped supplies are sterilized. These areas include the operating rooms, clean core, sub-sterile areas, and areas where flash sterilizers are housed. In some facilities, the halls outside the operating room may be considered restricted. Masks must be worn in this area whenever sterile supplies are open. Personal protective equipment, such as goggles or face shields, may also be worn. The circulating nurse and scrub nurse work together to prepare the operating room for the surgical procedure. Together, they check the supplies and instruments that have been assembled. They use a list that includes everything needed for the procedure. This is called a physician's preference card or a pick list. The surgical pack is opened to create an area that is free of microorganisms that can cause infection.